All right, so here is my surroundings. Okay, so turn that sideways. So Margie Case, some of the abnormal findings in her case is that she has beads of perspiration on her forehead and upper lip. She's very fidgety and she has swelling on her anterior neck. So that is also really abnormal. She also says that she's 7 pounds under her normal weight, so that's abnormal as well. And she's lost some weight, but she doesn't deny any throat pain or difficulty swallowing, so that's kind of weird if she has swelling on the neck. So for my focused assessment, I'm going to do head, neck, and like related lymphatics around the neck area. Hi Margie, my name is Katie Smiley. I'm going to be your nurse today. I'm a student nurse at HAC. Can you please state your name and date of birth?
I'm Margie, and my birth date, well, I'm 19.
Okay. Can you tell me when your symptoms of your neck started?
I don't know exactly when this started. I don't have any throat pain or difficulty swallowing.
Okay, and where is the overall location of it?
I've noticed that my shirts do not button at the neck for about the last 10 months.
Okay. And what is the duration of this? How long has this lasted?
It seems it has been getting worse over the last few weeks. I know it wasn't like this at my last physical exam last year at this time.
Okay, can you describe how you're feeling, like the characteristics of it?
I feel shaky, my heart is beating fast, and I feel jumpy all the time. I feel jumpy,
Okay. Is there any aggravating factors that make it worse?
I notice that lights bother my eyes sometimes, and sometimes I see double.
Okay. And is there any relieving factors that make it feel better at all?
I'm hungry all the time lately. I've lost some weight, about 7 pounds. I feel irritable and jumpy, and sometimes I can feel my heart pounding in my chest.
Okay. Is there any treatment that you have tried to treat this?
None so far.
Okay. And what are the impacts on your daily living? Like, does this impact you at all?
Well, I don't feel right, and I can't concentrate.
Okay. And what are your coping strategies? How are you coping with this?
I cope with stress by staying busy. In fact, I can't settle down because of the way I feel all the time now.
Okay. And how do you feel emotionally about this?
Well, the weight loss and jumpiness are starting to worry me. I'd say that's about a 7 out of 10. And I'm really worried that there is something major wrong with me, but I don't have any idea what it could be.
Okay, so your severity you said is probably 7 out of 10?
Yes.
Okay. All right, so now I'm going to start the assessment portion. So I'm first just going to observe your head and neck to see if it's symmetrical, and obviously your neck is swollen on the side. Now I'm going to palpate your head just to feel for any scalp abnormalities, and I'm also going to palpate your neck. With my 2 fingers in a circular motion, I'm going to palpate your thyroid. Okay, and I'm going to test your range of motion. So can you turn your head to the left for me? To the right, up, and down. Okay, great. And if I had a stethoscope, I would check his thyroid using the bell side to see if I heard any swishing noises or anything. Now, if I had a cup of water, I would ask you to take a drink. So just swallow for me. Okay, and that would check his thyroid. And I would palpate it. I would observe it to see if it's symmetrical and see if there's any color, anything wrong with the color. I did the water, drinking of the water, and I would do the stethoscope. Oh, can you turn your head to the right for me? and I would check his jugular and carotid arteries in the lymph nodes that would be affected since the neck is swollen. So I would check those. And finally, I would palpate the lymph nodes. So I would start right here, and I would go down to the jaw, and then also down the neck to try to feel if the lymph nodes are enlarged, which in this case they are. So that is the end of my assessment for Margie Case.